I'd like to start the story of Giovanni Battista Morgagni with a clinical case report. Clinical case report goes back to 1705. It's about a man of 72 years of age who gives the following history. He had begun about 2 weeks prior to his admission to the hospital to have a little bit of pain around his navel. This lasted a day or so. It was accompanied by some nausea, a little bit of vomiting on the third day. And then finally he began to notice that the pain had migrated down to the right lower quadrant of his abdomen. And it got worse and worse over the course of a couple of days. And about the fifth day of the time that he was having these symptoms, they rapidly began to get worse, and he noticed that he was feverish, and not only was he feverish, people were telling him that his face was red. A day or two after that, although he was still working, how he was doing it, we're not quite sure. He was a laborer in the town of Forli, which is near Bologna. People would say to him, you know, you're limping, you're favoring your right leg, as though there is something hurting in your leg. So he'd be walking along, almost dragging that leg. And then one day, about 2 days after that, he just took to his bed. He couldn't do any more. So we're now into about the 12th day of the disease, and that night he had a convulsion. It was actually a fever convulsion. He stopped making urine, which terrified the members of his family. And he went into a coma about day number 13. By day number 15, it was obvious that he was going to die. His face looked shrunken. He was pallid. He was mumbling incoherently in the midst of his coma. And then finally, after 2.5 weeks of this illness, he died. His body was taken to the hospital. He had not been admitted to the hospital while he was sick. It was taken to the hospital so that it could be dissected by a young man of 23 years of age, Giovanni Morgagni, who was working at that time as an assistant to the professor of anatomy, whose name was Antonio Valsalva, a very famous professor at that time and since. They put the body down on the slab, and Morgagni opened it from the sternum, the breastbone, down to the pubis. And he was astonished at the horrible odor that immediately filled the autopsy room in which he was doing the work. The odor was clearly coming from something deep inside the abdomen. And what was it? It was an abscess that had burst out into the general abdominal or peritoneal cavity, so that clearly this man had died of peritonitis. The abscess, as the dissection went further and further, revealed itself to be in the right lower quadrant, where the man had had his pain. Clearly, he had been limping because the abscess was lying on a muscle near the backbone, a long muscle called the psoas muscle, that actually attaches very close to the hip, so that the pain in this muscle was the real reason he was walking so badly. As Morgagni dissected through this abscess, this was in the days before gloves, so he was doing this barehandedly. He's dissecting down toward the base of the cecum, the blind pouch where the large intestine begins. And he finds there a tiny little structure that had never been described, although anatomists had noticed it when they did dissections, a little worm-like structure. In later years, it would become called the appendix. This worm-like structure had actually essentially exploded. This man had died of a ruptured appendix in 1705. Many, many years before anybody described appendicitis. A little side story. Leonardo da Vinci in 1505 had not only identified the appendix, but had identified the fact that it sometimes got inflamed and sometimes got ruptured. But of course, Leonardo's work had been lost except to Leonardo, and it was hidden away in trunks and crypts and who knows where. So nobody knew about Leonardo's work. So to Morgagni, dissecting this area, this was a shocking discovery, that this little structure at the base of the cecum could get infected, could blow out and cause an abscess. Of course, millions of people have died of a ruptured appendix, but this was Morgagni's first experience with it. So, being stunned by this, he discussed it with Valsalva, and the two of them made up their minds that since they were doing so much dissecting of patients who were brought to the hospital either immediately after death or within days of death, or at the very most weeks of death, why don't they just start dissecting everybody? And why don't they keep accurate notes of the clinical story of each patient? They would talk to the family. If the patient was still alive and could speak, they would talk to him. So they would have these notes, and then when the patient died, they would take him to the autopsy room. So they began doing this. And this is actually the story that I'm going to tell you as it evolves during the course of this lecture. What Morgagni found in 1705 had nothing to do with humors, and he knew it. It had nothing to do with some vague, generalized, Hippocratic notion of disease that affects the entire body. It had nothing to do with innate heat, and it had nothing to do with where the patient lived, whether he lived on a sunny hillside or on a tundra. It had to do with some specific thing that had happened in a specific place within his body. Well, so they begin doing these dissections, and they begin keeping records. 55 years later, when he is 78 or 79 years old, this, at that time, young man, Giovanni Morgagni, published a book with 700 case reports in it of this type. Patients, most of which he and or Valsalva had dissected over the years. At first it was one of the two of them. Later it was almost completely Morgagni, although there are some cases that were dissected by others where they had accurate case reports. And after that book was published, it was understood that no longer does one look for the origins of disease in an entire body. One looks for the origins of disease in one specific place. What an extraordinary turning point in the history of medicine this was. It came to be called, this notion of looking in one place, the anatomic concept of disease. Disease understanding had to be based on anatomy. No vaguenesses anymore. You had to know anatomy like Vesalius had described anatomy 200 years before, or you couldn't make any diagnosis. The entire thing is epitomized memorably by a single phrase that Morgagni used. He said, symptoms, the complaints that people come to you with are, quote, the cries of the suffering organs. So from then on in, diagnosis became an important thing for doctors. You had to listen to those cries. You had to interpret them. You had to figure out where they were coming from so that you could localize the disease. The question that doctors would frame from then on in was stated in Latin as ubi est morbus, where is the disease? And that became the puzzle. That became the exciting thing that physicians would then be doing from there on in, because it was understood that disease arose from anatomical changes, and then later on, as the years progressed, also from biochemical, physiological changes. So the Hippocratic notion that diseases are these generalized things was on the very verge in those years of dissolution. This book was finally published late in the 18th century, in 1761, and it started the process that brought us physical examination to begin with, and then the idea of treating this localized disease as early as you possibly could find it. So let me tell you a little bit about Giovanni Morgagni. He was born in a little city called Forli, actually the same place that this patient had come from, in the year 1682. He went to Bologna, only 30 miles from Forlì, to study medicine under the great Antonio Valsalva. He got his degree in 1701 when he was 19, and such was his brilliance, recognized immediately by Valsalva, that he said, you know, I need an assistant. Would you be my assistant? And what a great opportunity it was for a young man, because here was Valsalva, the great anatomist. He was dissecting some of these corpses, and of course it was during that early time that they dissected the corpse of the old man who died of his ruptured appendix. So he worked with him, Morgagni worked with Valsalva for about 6 years, absorbing everything the older man could teach him. And then, like so many people who start out in academics, he decided what he really wanted to do was to practice medicine. You'll remember this was Vesalius' situation. After he wrote his great book, he became the physician to the Holy Roman Emperor Charles V. So he went back to Forlì, to his own town, to be essentially a family physician in this town. And he stayed there for 5 years. And during that 5 years, he had quite a large practice. And he built up an understanding of clinical medicine, of actual patient-centered medicine, that would serve him very well for the rest of his career, because at the end of that time, he was invited to Padua, good old Padua again, the center of learning, still in the 18th century, a place where people from all over Europe were coming to study medicine. Morgagni, unlike some of the other great medical discoverers, had within his soul, within his heart, this extraordinary calm and serenity. He was a devout Roman Catholic. After all, his name was John the Baptist, Giovanni Battista, and he proved his Catholicism by having 15 children in his lifetime with one wife. He had 12 daughters. He had 3 sons. Every one of those daughters became a nun. And the reason was obvious. It had to do with the very religious atmosphere that existed in his household. And it's fascinating that someone with such a devout belief in God should be able to put it aside when he's doing his research, which of course has characterized the lives of scientists who have been people of faith all through the years. One obviously doesn't have to be an agnostic or an atheist to be a great scientist, and Morgagni is the perfect example of that. So here he is, invited to Padua to become professor of anatomy and surgery, at first junior professor, and then later on he becomes the professor of anatomy. So, although primarily an anatomist for the rest of his life, he still continues to think of himself as primarily a physician. So he's always doing his anatomical studies with the thought in mind, what is this going to teach me about diagnosis? Although he is an anatomist, what begins to happen to him is that people learn about his studies, and doctors from America, from England, from Russia, from every European country begin writing him letters asking him to consult on their patients. And he does this by mail. About 25 or 30 years ago, a book of these consultations was published. They were rediscovered. The notes, his notes, were rediscovered, and the so-called consulti of Morgagni were published, and they are available to read. And they're fascinating because they describe the perfect clinician of that time. And all this period, he is dissecting. He's not seeing patients anymore, but he's studying their case reports, their clinical case reports. Now, over the previous century, doctors had been doing individual dissections of individual dead bodies of people who had had diseases that they recognized and treated before. And finally, in the year 1679, a man named Theophilus Bonitas had brought a lot of these case reports together into the first book of this kind, which was called Repository of Anatomy Practiced on Corpses. In Latin, it was Sepulchritum Sive Anatomica Practicum. It's called Sepulchritum by historians. There were something like 470 authors in these 3,000 cases, Morgagni, Valsalva had studied this book. It wasn't very helpful. It wasn't very helpful because, first place, there was no index. There was no way to find any particular disease, any particular set of symptoms, and the whole thing was one big hodgepodge. So early on, Morgagni decided that when he put his book together, he would not only have accurate symptoms, accurate case histories, accurate autopsies, but he would provide an index so that people could look at these cases and find cases that interested them. So he works on this for 55 years. And during the time he's working on it, when he's in his late 30s, early 40s, he meets a young man who is interested in this kind of thing and decides that the way he's going to write the book is in the form of letters to the young man. So he keeps writing these letters, and he ends up with 70 letters. And when the book is finally published in 1761, when Morgagni is 79 years old, it's composed of these 70 letters. And the book, which in Latin is called De Sedibus et Causis Morborum per Anatomen Indigatus, the seats and causes of disease demonstrated by anatomy. See the wording, the seats, where does it start? And the causes of disease as anatomy can demonstrate it. This book, which we call De Sedibus, became one of those turning points that we've been talking about in these lectures. The 700 cases are divided into 5 books. Currently, they're put together in 3 volumes, which is the way the 5 books originally came out. Diseases of the head, the thorax, the belly, surgical and universal disorders, and then the 5th book is a supplement. And the supplement contains those indexes that allow any reader to find what he wants. There's one index in which you look up a symptom, and it is associated in the index with the disease that caused it, and then you know which page to turn to. There is another index that is composed of pathological findings. So if you're dissecting someone and you find, for example, a scar on the left ventricle, you can look up scar on the left ventricle and find the page. And there is another index which gives the subject of each of the 70 letters. So if you are thinking about fever because your patient who you're treating now has unremittent fevers, you can't figure it out, you can look up fever. And there's Morgagni with some descriptions, perhaps 20, 30, 40, of people whose main symptom was fever, who he later dissected. And then he's got something else. It's a little bit like Bartlett's familiar quotations. What it is the names of passages that are most worthy of notice. You know, if you can remember 3 words from a poem, you look it up in Bartlett, and then he tells you where to go. One of my students came to me some years ago, and he said, you know, there's one case we all talk about, and thanks to the index, we can always find it. And the case is of a very tall, thin young woman described as a strumpet, out of whose home one day a man was seen to be rushing out, didn't even close the door, pulling up his trousers, and disappeared. Well, what happened was one of the neighbors, seeing the door open and being worried about what might have happened, rushed in to the prostitute's house. It was about 2 or 3 in the afternoon, as described very accurately in this case report, because the case reports are like stories. And there was the prostitute lying dead in bed, and as Morgagni puts it, the semen virili still dripping on her legs. So, what could she have died of, this young woman? When he dissected her body, this long, thin body, long, thin fingers, he found that the aorta, the main blood vessel bringing blood to the body out of the left ventricle, had within its layers shattered itself and dissected itself so that the aorta had torn. So that the aorta had torn, it's called a dissecting aneurysm of the aorta, and in retrospect, What she had was a disease described several hundred years later called Marfan's syndrome. Actually, it's been thought that Abraham Lincoln had Marfan's syndrome, but that's another story which we can tell at another time. But this is the way this book functioned, how easy it was to find what you wanted, and what a great guide it was. He had provided, Morgagni had, his readers with a veritable museum of medicine, all laid out. Well, I spend a lot of time reading this book on cold winter nights in the Northeast. I just pulled down one of my volumes, and he did not name any of the diseases. He was just describing them. So I find pneumonias and cancers and various kinds of stroke. I find Crohn's disease. I find ulcerative colitis. You name it, it's there among these 700 cases. And over the next few hundred years, these cases were accurately described by other people and given names. So with the publication of this extraordinary book, the first really distinct sounds of the humoral theory's death knell could be heard, because now no one could say every disease is caused by some vagueness. What you had to say was, okay, let's think carefully about the symptoms, the cries of the suffering organs. Where are they going to lead us? When we do that autopsy, what will we find? So Morgagni has been called, and will always be called, the father of this particular discipline, pathological anatomy, sick anatomy. You had to find sick anatomy. And he becomes something else. He becomes, as we review the history of clinical medicine, he becomes the father of the physical examination. Because you stop to think of what he did. Essentially, he's taking a history and he's doing the physical examination after death. The trick which clinicians realized soon after that book came out in 1761 was to try to figure out what one would find at autopsy, but before the autopsy, when the patient first came to you. And that is the essence of taking a history and doing a physical examination. That's the great game we all play as clinicians. The trick is to find where those cries are leading you. And to this day, if you go to any teaching hospital once a week, they have what they call the CPC, the clinical pathological correlation, where some intern or resident gets up and he gives a history and he describes the physical findings, and everybody in the audience has to tell what are they going to find at autopsy, or at operation if the patient is still alive, or at biopsy. But this, and we'll call it a game because it's a great game and it's lots of fun. It was started by Morgagni with this book, with De Sedibus. Now, remember, the book is published in 1761. We're sitting right in the middle of the Age of Enlightenment, that great Age of Enlightenment where people questioned everything, where nobody wanted to believe any given that had been handed down to them. This is what the so-called philosophes, the leaders of this movement, were doing. And one of the givens was that grand theories of disease, like the Hippocratics had given us, must now be discarded. That notion that everything is part of some master plan of the universe that is organized by the deity, by the demiurge, by the great craftsman, the old Galenic notion, that must be discarded. The grand theory had to be, according to most people before this time, part of the thesis of predeterminism, that there was no human control over it. Things went the way they went because this demiurge had decided this is how it would be. From that moment on, from the publication of De Sedibus on, medical scientists, and of course all scientists, began to realize that now aims must be more modest. You don't make a general theory and then make every one of your observations fit into the general theory. The notion that Sir Francis Bacon had started, that William Harvey had worked with, which was inductive reasoning, that notion became the hallmark of everything that medical scientists did. They just started making little observations. And we'll hear more about that in subsequent lectures. And as the little observations were made, with nothing usually in particular in mind, eventually they would come to seem to tell a story that led to a hypothesis about why one could make these observations, and then, of course, the experiment, and then, of course, the theory. What was required at this time was the accumulation of large numbers of facts, as simple as all that. Well, unlike some of the other books we've heard about in the previous lectures, Decidibus was immediately wanted by everybody who could get his hands on it. It was translated into language after language within a few years. A second edition was needed, a third edition was needed, and as I say, there were multiple translations from the original Latin. So, what a difference in atmosphere. What a change in point of view. What a complete reorientation of the way doctors have to think about disease. Now, in those days, of course, there were these huge lag phases. When I say everybody wanted it, I'm talking about every professor wanted it. Everybody who was a doctor because he graduated from a university wanted it. But of course, the vast majority of doctors had not graduated from a university in those days. They had learned what they learned by the apprenticeship system. They had apprenticed themselves to a local physician who had probably learned his art the same way. And they didn't care too much about this Decidibus stuff. But the leaders of medicine did, and those who determined the course of medical history did. And for them, it was no longer sufficient to just take a look at a patient, kind of touch him a bit, feel his pulse, not to see how fast it went, but just to see if it was strong or weak, or if it told you something vague. It wasn't sufficient to hold his urine up and look at it, or just give it a taste to see if there was sugar or acetone in it. Physicians began to make as their goal to predict the autopsy findings. That was what it was all about, and as I say, this is how the modern physical examination developed, which we'll hear about in the next lecture. Interestingly, when it was developed, the center of what we might call medical education or medical progress had shifted to Paris for reasons that will become obvious as we talk. At Morgagni's death in 1771, which actually happened very shortly after Decidibus was published, he was one of the most renowned physicians in the world. He had been doing these consultations through all of the years. He had written this most remarkable book that had changed medicine. He died in the house where he had brought up all of those children at 3003 Via San Massimo in Padua. A plaque in his honor is on the wall of that house. And if anyone who is listening to me finds himself in Padua after he has gone to the university and found Harvey's stemma up there in the ceiling of the portico or loggia, it's worth asking a taxi driver to take you to that address to look at that plaque. But that plaque obviously is not his greatest memorial. His greatest memorial is his book, which was one of the most significant turning points in the long history of medicine.